Hi, we're here today to conduct a head-to-toe physical assessment. Prior to coming into our exam room, I went ahead and I washed my hands. We have pulled the curtain for the patient's privacy. We have already done an assessment of her overall general assessment, her nutrition status, her grooming, her mental status. We've gotten verbal consent from her. So we are going to go ahead and finish. We have checked her vital signs already, and she also has stated her pain, which she has no pain for this assessment. So then we'll go ahead and begin with her alert and oriented status. So can you just give me your name?
Nikki.
And your date of birth?
February 12th.
Okay, who is the president?
Obama.
And why are you here today?
To get a head-to-toe physical assessment.
Okay, so she is alert and oriented. So I'll begin with inspection on our assessment, and we'll go ahead and start with the skin. At this time, we'll start here, and then as we go through each system of our assessment, I'll assess the skin in other areas as well. But starting up top, looking at the skin, you want to first look at it and see if there's any bruising, lesions, anything like that. You check the texture, you check the moisture. You also check the temperature of the skin using the back of your hand on both sides. I'm also going to check hands for any kind of clubbing or edema, and also assess her capillary refill by pressing down and letting go of that. And everything appears to be normal. I'll start up at the head. And you want to do an overall inspection of the general symmetry of the head, shape and size, how it looks, looking at the hair, checking the texture of the hair, checking for any kind of infestations, the distribution, things like that. Any lesions, should go ahead and check the scalp dryness. We're going to palpate. You're going to look in there, see if you notice any of the dryness or bumps you feel around for any kind of tenderness or anything like that throughout the head. Moving down to the face, you check the symmetry of the face. You go ahead and look at the eyebrows, the eyes, the nose, the mouth, make sure the placement is good and it's symmetrical. I'm going to look at the shape of her brows to make sure that they're in general alignment with the eyes. Can you move your eyebrows up and down? Okay, good. I'm going to inspect the eyes, first looking at the conjunctiva, and you want to make sure it looks okay. You also are checking the sclera, the cornea. You're going to check the pupils. You're going to palpate the lacrimal gland, and you're also going to palpate the lacrimal sac. So you have her look up and press down in there. Looking at the pupils, we're going to go ahead and check for accommodation and check the size, make sure that the reflexes are intact. So I'd start from the left, go from the outside in. Good. And the other one. Good. And go ahead, can you follow my finger? And go up, down, right, left. And one more. Good. Making sure that all sensory function is intact. From there, I'll go ahead and I can palpate her sinuses, the maxillary and frontal sinuses. Check for any kind of pain or tenderness that's going on there. Look at the nose. Make sure there's no deviations or anything. Make sure there's no nodules. I will see if there's any kind of blockages or lesions or anything in the nose. Also check the patency of the nares. I'm going to hold my finger here, breathe in, and breathe in. Good. After the nose, I'm going to go ahead and I'm going to check her ears. So you want to check the overall symmetry, make sure they fit well, they're placed well on the head. You look at them, see if there's any kind of drainage coming out, any lesions or anything like that. You check the auricle, the lobes, and the tragus. No drainage, no tenderness upon palpation or anything like that. I'm going to go ahead and perform a whisper test on her. So if you could just repeat what I say to you. I'm going to go ahead and cover one ear and stand about this far. Chocolate.
Lemons.
Lemons. Chocolate and lemons. All right. That's an odd combination.
Yeah, it is.
That's what I came up with. Moving down from there, I'm going to go ahead and inspect the mouth. And to do that, I'm going to don some gloves. Okay, overall, you're looking at any sort of dryness or anything on the lips, and we're going to check inside the mouth at the uvula, the hard and soft palate, the dentition, check the teeth, the buccal and the gums. So go ahead, open, say ah, good. And you check on the insides of it, and then if you could stick your tongue out, we're going to lift up and check under there. Good, good. Sorry, a little dry. All right, and then if you could puff your cheeks out. Good. All right, take your tongue, stick it on the side of your mouth, push, good, and push over here, good. I'm also going to check dullness and sharpness on the face before I move on. We'll check some sensations first. Can you feel that?
Yes.
Feel that?
Yes.
Can you just tell me dull or sharp?
Okay. Dull. Dull. Sharp. 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 Dull.
Good. All right, and then we also want to test while we're up here the trapezoid and the sternocleidomastoid strength. So if you could just push resistance against my head and again. Good. Moving down, I'm going to go ahead and assess the trachea. The trachea, you can do this test from the front or the back. You want to palpate the thyroid gland. You go down and you feel, and then you would either have the patient drink some water or just swallow real hard. So take a swallow. Good. And you want to feel for any nodules or anything that's in there. While I'm on that point, I can go ahead and check all the lymph nodes. So you want to check the preauricular, the postauricular, the tonsillar, good, the submental, or the submandibular, submental's behind it, the occipital, and the cervical chains. Since I'm right here, I can also test the subclavicular or the supraclavicular and the infraclavicular. All right, and I can also test resistance and cranial nerves. Can you shrug your shoulders for me? Okay, can you push up? Good. Can you smile? Good. That'll just test that sensation is intact. From there, we're going to go ahead and move on to the chest. And in the chest assessment, the first thing you're going to do is inspection. So I'm going to inspect the chest, and while I'm looking at it, I'm going to look at the respirations, check for any use of accessory muscles, make sure that there's no difficulty there. I'm not going to tell her I'm checking for her respirations, because if I do, it'll probably change the way that she breathes. So you want to check the skin on the chest and check for any lesions, bruising, nodules, anything like that if it appears to that. And it overlooks good. This general shape and contour, a 2-to-1 ratio, which looks good. I can also check her turgor, which we check in a skin assessment, and I can check it here. We could also check turgor. You should check on multiple places for the elasticity of the skin. After visual, I want to go ahead and palpate the chest. So I'm going to feel for any kind of tenderness, lumps, bruising, anything like that along the wall of the chest. After I do the palpation, I'm going to go ahead and auscultate and listen to her breath sounds. And you're going to listen. Take a deep breath. Good. 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 We also need to do that on the we also need to percuss on the chest. So we'll go ahead. Sorry. And while I'm there, I can have her raise her arms, and I can also at that time check her axillary nodes. Deep pressure, I'm sorry. And the same on the other side. Get up in that pit. Good thing I put the order in. All right, now I'm going to inspect the posterior part of the chest, so I'll just have her turn around. And we're going to do the same thing. I'm going to check the overall symmetry of the chest. I'm going to check for any kind of lesions or bruising or anything like that. I also want to check her excursion, which I didn't do on the front. I need to do. So take a deep breath and let it out. Good. Then I'm going to go ahead and I will palpate the fields. And then we're going to also percuss. All right. And then we have to auscultate the lung sounds. Good. Take a breath. Good. Good. Are you dizzy yet? Not yet. And also do the lateral. Okay. All right, I'm going to have her turn back around. And we're going to do this sitting up, but I'm going to go ahead and listen to her heart sounds. First, I'm going to listen, and then I'm going to check for her PMI or the apical, and I'm going to listen to that along with her radial pulse as well. I'm going to try to palpate the apical pulse. Can you lean forward just a little bit? Okay, good. All right. Looking at the chest, back to inspection. You also want to check for any heaves, lifts, and you also look for thrills, or listen for thrills. We're going to move down to inspecting her abdomen. You could lay down. And I'm going to maintain our privacy. Just pull up where we need to look. So overall general survey of the abdomen. You're going to inspect, look for any kind of distension, any kind of bruising, any lesions. Look at all the quadrants, umbilicus, things like that. So first you just look at it. And then I'm going to go ahead and palpate her abdomen. And we'll start in the right lower quadrant and we'll move around clockwise. After doing that, I want to, I'm going to palpate. So we're going to start with a light palpation. And then moving with a deeper palpation, that's 5 to 8 centimeters deep. Any signs of tenderness or anything like that. All right, I'm also going to listen for vowel sounds. She's hungry. All right. Upon auscultating the vowel sounds, I also remembered as you listen to your heart sounds, you want to listen not only with the diaphragm part, but also the bell. So I'll do that now as well. Scoot under there. Now she can't see. Since I'm down at the lower part now, I could go ahead and check for the inguinal nodes, and also I can test the femoral pulse since that area is exposed and I wouldn't have to make her do it again. So you want to check right in the lines. Good. All right. Looking at moving down overall general inspection, you want to keep inspecting a part in the skin. I'm going to check. I can still check for turgor down here. But I'm going to just look at the skin, make sure there's nothing else. I can also check her dorsalis pedis pulse on both feet and checking the temperature of that skin. The posterior tibial, her popliteal pulse. Good. Her radial, the brachial, and the carotid. Good. All right, I'm going to go ahead and have her sit up. While sitting, I can go ahead and check some range of motion. You also want to check the joints and everything for any limited range of motion, any kind of tenderness, crepitus, anything like that. So can you just roll your shoulders a little bit? Okay, and your neck. Good. Let's see your arms. Bend. Okay, and we can also check for some resistance. So can you pull towards? Good. And push. Excellent. Also, we can go ahead and elicit some reflexes while we're doing the range of motion. So I'm going to check those reflexes. Good. everything's intact. We can do a little range of motion if you can push your feet up and down and all around, okay? And then if you stand for me, I'm going to have you do a couple of tests. First, I want you to turn and lean forward just a little bit. We're going to check just the spinal process all the way down. And I can also check the back of the kidney. Good. All right, stand up. All right. And then if you could, stand with your feet together and hold your hands out. Okay, close your eyes. Good. All right, and then stand with your feet together and your arms down by your side. Good. Then I want you to take your heel up just below your knee and rub your shin. Good. Now can you do that on the other side? Good. We're checking gait and balance. Now back up and we'll check some coordination. I want you to take your finger, touch your nose, and then touch my finger, and then touch your nose. Good. And the other side.
Finger, nose, finger, nose.
Good. Okay. You can go ahead and sit back down. I need to elicit reactions for sharp and dull on the rest of the skin. All right, close your eyes. Can you feel that?
Mm-hmm.
Okay. Can you feel on this side?
Yes.
Good. Tell me if it's sharp or dull.
Dull. Dull. Sharp. 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 Dull.
Good. And all that appears to be intact. Only other thing that we need to test is the one other part of strength and grip, where I'm going to have her grip. Make sure it's equal bilaterally, which it is, and she's done well. So you've completed your complete physical assessment. I appreciate your help, and thank you very much.